So why don't we go ahead and get started? I'm going to ask Matt Corrier if is Matt Corrier still on, or did he get popped out again to introduce us? Looks like he might have popped out. We'll just go ahead and get started. I'm going to introduce the panel to you. So I'm Matt Smeds. I'm the program director at St. Louis University, and I'm the communication chair of the Vascular Endovascular Surgery Society. So we thought it would be interesting to put this together for the applicants, because normally at the Vascular annual meeting every year, there's a residency fair, and it's a good time to meet all the program directors and hear about the programs. And because the VAM was made virtual, that kind of went away. So we thought this might be a good opportunity just to kind of be able to show your face and meet program directors like you were stopping by tables. This might be a complete dumpster fire, but we'll see how it goes, I guess. And so we've asked a panelist of current vascular trainees, they're all integrated residents at programs from across the country, to kind of weigh in on some topics on the match. And I have some questions for them. If you have any specific questions for the panel, put them in the chat box, and Vanita, our co-moderator, or John Rixenwald, will keep an eye on the chat box and bring those to our attention. But I'm going to introduce the panel now. So we have Shernaz Dasaboy, who's a PGY 2 at Stanford. We have Timothy Chilton, who's a PGY 2 here at St. Louis University. Justin Smith, who's a PGY 2 at Case Western. And then Elise DeRue, who's a PGY 3 in a research year at the University of Wisconsin. So that's our panel. And Shernaz is going to start off with a short presentation on the top 10 things to consider when choosing a residency. So Angela, if you want to put those slides up for her.
Yes.
And then get to the questions. If Matt shows up, we'll let him introduce us again. But.
And let's see, share screen. There we go. Share.
Great, looks good. Okay, well, thank you everyone. Thank you for inviting me to speak and be a part of this panel. It's definitely a huge honor. We can go to the next slide, Angela. So I'd actually like to start on a bit of a lighter note with a story from Aesop. And this one's about the man, the boy, and the donkey. And for those of you who haven't heard it, this is about, there was a man and a boy who were walking to market to sell their donkey. And on the way, they pass a village man who asks them, why are you fools walking beside the donkey when donkeys are meant for you to ride? So the man puts his boy on the donkey and they continue on their way. And then they ultimately pass a second villager. And this villager asks them, why is the young man on the donkey and the old man forced to walk beside him? So the boy gets off the donkey and the old man gets on. They pass a third villager. And now they pass someone else who accuses them, what's wrong with you, old man? Why are you riding the donkey and making the young boy walk? So after much debate, both the man and the young boy decide to get on the donkey. And as they finally finish their journey and approach the market, the poor donkey, having had to carry two people, collapses and dies. So what is the message of this parable? I think it's that if you don't know what you want, it's easy to become distracted and lose sight of your ultimate goal. And while the residency process is both confusing and anxiety-inducing, my hope for today is to give you some kind of a framework to allow you to feel in control of the process. Okay, next slide. So step one is really to know thyself. This is one of the oldest 3 maxims that's been inscribed at the Temple of Apollo in Delphi and really has been attributed to some of the greats, Aeschylus, Socrates, Plato, and really has formed the foundation of both Greek and Roman philosophy. Now, know thyself might sound abstract and simple, but I think it's really important to apply this to the residency process in terms of knowing what's important to you. I can say from my own experience, it took me quite a bit of effort to figure this out, and to come up with 10 things that were the most important to me was equally as challenging. And I think applying to residency, part of the process is going through the difficult process of deciding on what the important things are for you. And so I hope that you can at least try to use my 10 things and adapt it to what 10 things might be most important for you. Okay, next slide. So the top 10 things that I considered important. I think you have to advance it. Yep, thank you. Number one, so research or professional development years. So for me, my goal is to be an academic vascular surgeon. And so I really wanted these 2 protected years within residency to have that as a time to jumpstart that process. Now, if you know that you'd like to be in private practice or community medicine, spending 2 years on research might just not be time or cost effective for you. And that's something you have to figure out for yourself. Number 2 was partner's preference. So my fiance is a software engineer, and so he was quite mobile, and his only restriction was that he wanted to be on either coast. Now, if you're single, this might not be an issue for you. If you're couples matching, I would highly recommend talking to other residents who have gone through the couples match process. Number 3, location. So having lived all of my life in the Boston area, I really wanted to experience a new geographical area for residency. I think other things people consider are if they want to be in an urban versus rural environment, or if they want to be close or sometimes far away from their families. Number 4 would be cost of living. I had more flexibility in this area, and for me, that was a trade-off with location. That might be different for you. Number 5, it's kind of a bundle of what I call training experience and training volume. The way I found that was best to get at this question was to ask residents a simple question. Ask them what case they do the most often, and ask them what case they do the least often. And then also ask them, how does the case breadth or case load vary with different sites that they rotate at? And you'll get a lot of good information by asking them that. Number 6 was distinctive competence. What I mean by this is, what is the unique offering of the program? And what is it that program can uniquely expose or train you in? And also asking, what does that program uniquely bring to the vascular community? Number 7 was resident publications and presentations. I knew I wanted to try to continue publishing and presenting in residency, and I knew that was going to be a daunting task. So I really looked to see what were current residents doing, and did that infrastructure exist already in the program, so that I knew I would feel supported when I got there. Number 8 is mentorship. I came from my medical school at UMass, where I had excellent mentorship. And so for me, it was a real question when I looked at programs to see and try to identify who would actually be my potential mentors at each of these potential programs. Number 9 is resident autonomy, morale, and then culture. I think, it's really important to see, how do the residents treat each other? How are the residents treated by faculty? What's sort of the culture and the pulse of the program? Number 10. Number 10?
Yeah, okay, sorry.
That's okay. Number 10 is division, department, and hospital reputation. And what I mean by that is sort of, how is the division viewed within the Department of Surgery? How is the Department of Surgery viewed within the hospital? And then how is the hospital viewed within its region? I think that just gives you a sense for, especially if you're new or don't know the area as well, to get a sense of sort of, where does that hospital rank compared to others in the area. So these are the things that were important to me. And, I think you really have to ask yourself some hard questions to figure out what's important to you, and to sort of come up with your own list. Next slide. So, once you've thought about what's important to you, you can now start to develop your list of objectives and then put them to paper, or, in an Excel file. And so what I did is, after coming up with sort of my list of objectives, I gave each one a relative weight to total 100. So for example, you might give 10 points to location, or 10 points to research. And that's dependent on you and whatever you think sort of fits what you need. And only after you've done this, sort of come up with your list of objectives, weigh them and rank them, then you're really ready to look at the programs and to see which programs best fit you. Next slide. Oh, change back one. Step 3. So step 3 is dig deep into the programs and get to know them so that they can get to know you. What I mean by this is that, a lot of the programs are going to sound good to you on the surface, but it's really not until you dig deep and really get to know them. Now, for me, that meant trying to do as many visiting sub-Is as I could to really get to know individual programs. And I realized that I applied to residency pre-COVID, and many of you will not be able to do in-person sub-Is. But if you're a fourth year student now, I think you can take advantage of the many great virtual sub-Is that are being offered at lots of different institutions. And if you're in your third year, then I don't think it's ever too early to start thinking about where you'd like to do your away rotations and actually develop a plan for next year. And then finally, if you can't visit in person, talk with as many current residents and faculty members as you can at these programs to really get to know each program well. Next slide. So finally, after knowing yourself, developing and weighing your objectives, and digging deep into programs, you can now develop your own rubric to try to organize and track programs as you progress throughout the application cycle. Next slide. So here is a very honest example of how I created my rubric. And you'll see last time I updated this was February 2019, before my match list was due. And so, this is just to show you one way of doing it. This is what worked for me. And, you'll have to adapt this to your own needs and come up with your own rubric and scoring system. Next slide. So in summary, you really have to dig deep into yourself, dig deep into programs, and then have a rubric to put it all together. If you invest in this process and you do the hard work up front, your rank list will practically be done for you come, February or March. And I think most importantly, you'll feel that you are in control of the process rather than an algorithm deciding where you're going to match. So I'm sure my colleagues have lots of other good ideas and valuable lessons from their own experiences. And so happy to turn it over to the panel now.
Great. Thanks for that talk. Maybe I should go back and reapply now, knowing what you said, and maybe I'll go to a better place. Just kidding, because I went to SLU. It's a great place. I'm going to introduce Matt Corriere, who's the president of the VESS. We got him on, and I just want to give him the opportunity to welcome everybody. So Matt, did you make it on, or?
I'm here. Can you hear me?
Yep.
Yeah, so thanks. Sorry, I was having a technical problem. The demand for this has been fantastic and higher than anticipated. I just mainly wanted to welcome you. Thank you for your interest in vascular surgery, and also welcome you to get engaged and continue to interface with VESS. I hope you'll see by the nature of this talk, I'm the VESS president, but one of our members, Dr. Smeds, brought this idea forward. And I think you'll see on this call that, we're a national society, and the session's very much being run by junior people with a lot of residents and students doing most of the talking, and that's what we aspire to. We feel like the early career and in the career pipeline, young folks are who we target through our society. And I just wanted to say welcome and look forward to hearing more of the content. Thanks.
All right, great. I'm going to reintroduce the panel just in case people forgot. So we have, again, Shernaz Dasaboy from Stanford, who just gave that great talk. We have Justin Smith from Case Western, Elise DeRue from University of Wisconsin, and Timothy Chilton from St. Louis University. So I'm going to throw a question out here and to all of you, and feel free to answer it. And that was, how many programs did you apply to? What do you think is the right number of programs to apply to? And of those programs you applied to, how many did you end up interviewing at? Do you think you interviewed at too many, too few? So can you give us your thoughts on those questions?
Oh, sorry, you go. I think I applied to about 34 programs. I chose to interview at 11. I think it was a nice, given the, I chose to drive everywhere, and, the resources and time to do that. It was good. I felt I got enough variety, at least in my region.
Anybody else?
I applied to, I think, about 25 programs and probably interviewed at about 75% of them. Part of my decision to interview at so many places was also influenced by fact that I was couples matching with my husband, who was applying in plastic surgery. So that ended up being a good number, but I think it would have been hard to interview at many more. That was a pretty packed schedule and was only really allowed in my schedule, given that I had several blocks where I was completely off from clinical obligations.
Great. So if you were to look in hindsight, is there anything that you wished you had looked at when you were looking at residency programs? So some aspect that you didn't appreciate until now that you're in the residency that you wish you had looked for, without throwing your current program under the bus, I guess.
I think that answer kind of depends on a few things. If you're thinking about aspects of the program itself versus aspects of geography and patient care, I knew when I was applying, I was looking to get an area that was going to be higher trauma, but that was really all that I had in mind. Kind of looking back, I don't think I would have changed anything with how I applied. I kind of applied broadly. But I don't think that looking back now, there's anything I would have changed in how I applied.
We have a question from the audience. Did anyone on the panel dual apply to general surgery and vascular surgery, even if you knew vascular was for you, just for assurance, I presume?
I did.
Yeah, I also did, and part of that was influenced by the fact that I was going to couples match with my husband and wanted to make sure we didn't narrow down our options.
So maybe a follow-up to that, what percentage of your, what percentage were general surgery, vascular surgery? Was it just?
From my perspective, I applied to both, and once I think I had over 14 or 15 invites for vascular surgery, I stopped accepting any general surgery because I felt that was a number that would be fair enough to match. I did still have a couple general surgery interviews, and I kept the ones that I wanted to that were kind of close to home, just because travel-wise and expense-wise, that was easier for me to do than travel all over the country. And so I limited my general surgery interviews to just a handful, and then when I made my rank list, I ranked all of my vascular surgery programs higher than my general surgery programs.
Yeah, I think I did. I applied to roughly maybe a third of, maybe even less of the general surgery program number-wise, and I did vascular, and that's just because I guess you go in very insecure, so for some people like myself, and then you don't know if that thing's going to pan out, what the return is going to be like. I think I was in a similar position as Tim.
That's a great question, and there was a follow-up question asking, was that frowned upon? And I think perhaps the panel and then perhaps some of our program directors that are on should answer that as well, what they may think about that.
I can answer that from a program director standpoint. I don't really care if you dual apply, honestly. You're trying to optimize your chances, and you can get the vascular through general surgery as well. We all know where your heart is, but it doesn't hurt your application just that you're applying general. I don't ever ask if necessarily, usually if you apply for general surgery, because frankly, I don't really care, but it wouldn't really hurt if you told me that.
I'm going to say the same thing. Just make sure that your letter says vascular surgery when you're sending it to vascular faculty and general surgery to the general surgery faculty, because I've had that mix up and then it just looks a little disorganized.
I also wouldn't hide anything. So when you're on your general surgery rotation, tell them you're interested in vascular surgery. I mean, I did general surgery, Matt did general surgery. I think Benita did general surgery. So, we all went through the general surgery process. So,
Matt, are you just calling us old? Because there was no residency when we were.
Yeah. So we're all old. So we all went through it. And I think we all benefited from it. And I don't think we have any problems with people going through general surgery. So just be honest with the people who are interviewing you for general surgery and you'll be fine. So given the virtual aspect of many programs that are doing interviews this year, is there anything that you think the applicants should look for or ask about during their virtual visit that they may not be able to appreciate since they're not seeing the place in real life? And then a second note to that is, how do you think the applicants can make themselves stand out in a virtual environment? since they're not doing this, in real life. Any thoughts on that?
Sure, Naz, do you want to weigh in since we have a virtual sub-I and you've been participating on it? Perhaps you can answer that question or give some perspective.
Sure. Yeah. I think, I think we're all trying to pivot and figure out how to get to know students as well who are coming to visit with us. So I guess number one would be if there is a virtual sub-I program, trying to participate in that is sort of your number one way to kind of help you stand out already. And then number two, I think it's all the same things as when you're meeting someone or interviewing in person. Mannerisms and presentations certainly come across when you're on a Zoom call. So making sure, you're putting your best foot forward in that sense as well. And then I think ways to get to know programs when you're doing it remotely or virtually, or try to use your connections. That's what I'd recommend. So for example, like I went back and looked to see from my med school who were all the people that graduated and matched into vascular surgery. And I literally got their emails. I kind of cold called them, reached out to them, and I ended up making a ton of great contacts that for me, like facilitated getting sub-Is and interviews. But for you might facilitate someone saying, hey, I have a colleague at such and such program, like let me put you in touch with them. And I think it's just as many kind of connections as you can form, the better. And then of course, reaching out to any of us here, we're more than happy to talk with you or help set you up with someone else we might know. So I think that personal introduction really goes a long way.
I know it's kind of, this is all kind of new ground for us because we're exchanging an in-person process for a virtual, but the way I'm kind of framing it in a positive light, and I think it's going to be beneficial, is that you're like Srinath says, you want to do all the same things that you would be preparing to do if you were sitting in front of somebody, showing your enthusiasm, being animated, asking lots of questions about the person that you're interviewing with, but also about the program and the direction the program is going in. And that shows you've done your research, and it shows that you have a really big interest in learning as much as you can, because you may want to see how you fit in there. And again, like Srinath says, is trying to overcome the barriers of not being able to be there in person, showing your interest by talking with the residents that are already there over the phone. That's probably the best way. You just have to reach out in many ways as you can. Just because I'm sure all the programs are just looking for someone who is a solid worker, but is enthusiastic about training at that program. And it's all going to be, we'll find new ways to do that. So it's all going to be a learning process for you all.
Great. So I think what we're going to do is that the program directors are going to break away and we're going to go to our rooms. Angela, if you could leave this room up for a little bit and the panel could answer a few more of these questions that are coming up on the chat box, that would be great. And then whenever you guys just want to head to the other rooms, just feel free to go to the other rooms. This is really just go wherever you want, duck in for a few minutes and learn whatever you need to learn. Nobody's going to take offense if you just pop in and pop out. It's just like a real, residency fair where there's tables set up and you kind of wander around. So feel free to stop by and let us know if you have any questions. You can feel free to send me an email and I'll be able to answer any questions you have. So I'm going to leave this room, and then the panel will stay for a little bit longer and answer these other questions that are in the chat box, and then we'll go from there. So good luck, everybody. Hope to see a lot of you at St. Louis University when you come to interview. So take care.
Hi, guys.
I did want to answer a question that I saw pop up a little bit earlier, and I kind of thought would come up at some point. And if people are still kind of hanging out and listening, I do feel that being a DO in some places is going to hurt you. Some places do look at degrees, and some people do say, okay, osteopathic medicine is really not going to be as competitive in a lot of the, especially surgical specialties. That being said, I think the way to stand out if you are a DO is to make sure that you take step 1, step 2, and take them seriously. I know a lot of DO programs kind of say just take it enough to pass, or some places don't even require it. Take the time to really study for it. Take the time to invest in it. I know it's expensive to do level 1 and level 2. And then step 1 and step 2 on top of that, but it'll help you out. I know on a couple of my interviews, people said, if you hadn't taken step 2, we would have just put your application somewhere else. We wouldn't have looked at it. I think it's important as a DO if you're gonna apply to a competitive specialty to make yourself as competitive as possible, and that includes, you know, extracurriculars, research, and then taking, again, like I said, step 1, step 2, and then if programs don't look at you because you're a DO, I think that's their loss. Doesn't make anything less of you. It's just, it's older culture, and I think it's changing, but that's the unfortunate part of having that degree.
Any other questions at all?
Hi all. One question. As residents, what are you looking for in future applicants or your future co-residents?
Number one, just, you know, when you start residency, it's kind of obviously the real experience is much different than how you experience as a medical student. Like, so, and especially in vascular, a service that we're called upon a lot to help other colleagues with their disasters or their complicated problems. And so you really want dependable people who are driven to kind of make things run smoothly and help out very complicated patients. So you just want to at least have someone who's dependable. And, you know, I'm still trying to figure out interviewing people, how I can, you know, feel that out in somebody. But I think at the very basis, someone who is willing to continue to learn and improve their knowledge and skills, but also being there in the trenches with you, because it's a difficult job, and as a resident, you're the one on the ground of it. So it's yeah.
Yeah, I also think you know, as a resident, you're going to be spending a ton of time with your co-residents, often far more time than you spend with your families, significant others, and friends. So it's kind of hard to describe, but oftentimes you'll feel if you match well with a group. Or, you know, it's sometimes variable how comfortable you feel from place to place. So I think there is something to be said for going off the feel of how you interact with the people at that institution, because you're going to be spending a lot of time with them.
There's a small question I guess to answer from Joshua, University of Oklahoma. Yeah, I think you reach out to the department and try to find the residency coordinator. I'll always speak for myself. I'm always willing to talk to people who want to learn about our program. So just to put you in touch with residents, just go to the program coordinator at the VESS.
I think for the MS3 being interested in vascular surgery, I that wasn't my story, but I definitely helped some other people that were sort of in those shoes. And I think what they found most helpful is, you know, I know traditionally I would say like go to meetings and try to do sort of small presentations and networking, and I realize that's not happening, but a lot of the virtual meetings are still happening. So I think attending those can be really great. If you know, identifying a mentor at your institution would be really important at this stage. And then, you know, trying to maybe put together a case report or a sort of something small in research. Not that everyone has to have research, and it can be in something that's non-vascular, but I think that would really kind of go the extra mile to sort of maybe do a small case report or hop on a project that some of the current residents are doing. Yeah, I'd probably say find a mentor and then maybe find a project. Those two things would be helpful to do as an MS3. I think there was an interviews question, but I think maybe that's better suited for the program directors. I haven't heard about them really changing anything about, I don't even know if our interviews are going to be in person or virtual yet this year. I don't know if others of you know about your program.
No idea.
Yeah. Okay. If there aren't any other questions, no. If there are no other questions, I guess we can let people go to the rooms, and we'll be in the rooms too, or I'll be in the rooms for a little while too. So.
Yep, and if anybody just joined, I had sent out an email to pretty much everybody saying that we didn't realize we maxed out at 100. I apologize for that, but this was recorded and we're going to post it and send it out to everybody so they can hear what was to be said. If you have any questions, you can just shoot an email to VESS@administrari.com and we'll make sure that your questions get answered. Yeah, just good luck.